Child hip slippage is a condition that can easily go unnoticed, but it can lead to serious health issues. Stay with me to learn the warning signs before it's too late. Basically, this is what every parent needs to know.
Please subscribe.
Dr. Boisvert, Canadian chiropractor, here to discuss an important condition that causes hip pain in children going through puberty, something every parent should be aware of. In previous videos, we talked about hip colds and avascular necrosis, conditions mainly affecting younger children between 3 and 10 years old. Now, we'll focus on a condition that affects children in the midst of puberty. If you missed the earlier videos and are interested, just comment hip cold or hip necrosis. You might be wondering if your child's hip pain is more than just growing pains, or why your child might be more susceptible to developing this condition. During puberty, bones grow rapidly, which can make growth plates, known as the epiphysis, more fragile. Additionally, during puberty, growth hormones and sex hormones activate more intensely, potentially weakening these growth plates and making them more prone to slipping, a condition known as slipped capital femoral epiphysis. One key risk factor is being overweight. If your child is obese, they are at higher risk of developing this condition, as the extra weight puts increased pressure on their joints, especially the hips. Sometimes, bones grow faster than muscles and tendons, leading to a musculoskeletal imbalance that can contribute to the condition. Lastly, genetic factors also play a role. If someone in your family has had this condition, your child may be at a higher risk. It's crucial to confirm the diagnosis before starting any treatment. Once epiphyseal slippage is suspected based on symptoms and a proper clinical evaluation, medical imaging is necessary. X-rays of both hips are typically taken to assess bone health and compare both sides. These X-rays help determine the extent of the slippage, often referred to as Klein's lines, which are horizontal lines on the upper edge of the femoral neck. Sometimes, X-rays may not clearly show epiphyseal slippage, in which case additional tests like ultrasounds or MRIs might be needed to rule out or confirm the diagnosis. These tools allow us to fully understand the damage and offer the most appropriate treatment. The first symptom you may notice in your child is hip or groin pain. This discomfort usually starts mildly but intensifies over time, eventually becoming a more serious pain. It can occur after physical exertion, rest, or even appear without any apparent cause. If your pubescent child starts complaining of hip or groin pain that worsens over time and isn't relieved by physical activity, movement, or rest, this is a symptom you should never ignore. In addition to pain, progressive stiffness in the joint is another key symptom. For example, your child may find it difficult to move the hip or perform everyday movements like getting out of bed or climbing stairs. Another alarming sign is if your child begins to limp, unable to put full weight on the painful hip, especially if there hasn't been any recent trauma or sports overload to explain the joint pain. Clinically, children affected by this condition may even present with their foot in external rotation and find it painful to rotate the foot inward due to hip pain. Studies show that more than 15% of children present with pain in the knee or thigh, not necessarily in the hip. This is referred pain, meaning the true source of the pain is in the hip. If you visit a chiropractor, they should provide clinical documents to coordinate care with your treating physician, highlighting the importance of collaboration to ensure the best outcomes for patients. If left untreated, epiphyseal slippage can cause permanent damage to your child's hip joint health. To treat it, orthopedists typically recommend surgery known as osteosynthesis. This procedure involves using screws or plates to stabilize the growth plate and allow optimal healing. After surgery, it's essential to avoid putting weight on the affected hip as much as possible, which means using crutches or other walking aids until your doctor confirms the hip has healed properly. It's also important to start a rehabilitation program that avoids putting unnecessary stress on the hip while still working on the surrounding muscles. Activities like swimming or home exercises can help strengthen the joint. Fortunately, we already have a video covering common causes of hip pain in adults with exercises at the end designed to strengthen the hip without risking further injury. The link should appear now, along with the video on avascular necrosis. Feel free to share your story, comments, suggestions, or ask any remaining questions. because an informed person is someone in control of their health.